Hey, sixth graders, how's it going? Sorry I'm not there today, but you have Miss Anderson, so you're in good hands. She's my mentor. So today we are going to be learning about CPR. But for starters, just a quick little review of our unit so far. So we talked about the very first thing we should do if we're at the scene of an accident is we want to check the scene. We want to make sure that the scene is safe. And if the answer is no, we do not want to approach the scene of an emergency. We do not want to become another victim that somebody else has to take care of. But if it is safe, we're going to go up and we're going to check the person. First thing we're checking is for consciousness. We're going to tap and shout. And then we're checking to see if that person is breathing. And the way we do that is we get really close to that person's mouth and we look, listen, and feel. We're looking to see if their chest rises up and down. We're listening for sounds of breathing, and we're feeling for some breath on our cheek. If we notice that there is no consciousness and no breathing, we would first call 911, and then we're going to go into CPR. If the person is conscious and breathing, or is unconscious and breathing, then we would not do CPR. We don't do CPR on a person who's breathing or conscious. All right, then we're going to be calling 911. And remember, use speakerphone if you're alone. You're going to give them lots of information. If you're in a group of people, you're going to assign somebody specific to call 911 so that that person knows that that's their responsibility and we don't have everybody thinking somebody else is going to call. And then after that, we're going to do the best we can for that person, which is called first aid. We're going to do the best we can just until the professionals arrive. And then once the professionals arrive, we're going to get out of their way and let them do their job. And we're going to stay nice and calm. So we have a little check-in today, similar to the one we did last time. What are the two most important steps in treating a choking infant? We learned last time and we watched some of our classmates practice. If you had to remember two things outside of calling 911, what would be the two most important steps in treating a choking infant? And then down here, what are three precautions you could take to prevent an infant from ever choking in the first place? Three things that you could do that would prevent them from ever choking. This is I as in Indiana. You can use the notes from last time if you need them, but if you remember, maybe you don't need your notes. And you can decide if you're going to do this by yourself or with your shoulder partner. Don't turn it in because we're going to go over the answer together. And if you finish early, you can go to the Padlet. All right, you can go ahead and get started.